Let's now look at a big problem in the workplace, certainly here in the UK, and that is absence due to long-term sickness. Here in the UK, the level of people off work due to sickness has been flagged as having a drag on both the economy and individual companies. According to new research, over 100 million sick days were taken last year by people with long-term health conditions. The study was carried out by the Centre for Economics and Business Research alongside the insurer Zurich. I spoke to Zurich's head of market engagement, Peter Hamilton. He explained more detail about their findings.
If you look at last year's figure, it was about 32 billion and it had increased the previous 3 years. But you can see if it were to carry on at the same rate of growth now, it's going to be up by 60 billion. So it's not great for the individual employee who's off work, for his or her family. It's not good for the employer who's going to have to cope with that kind of disruption. And as the figures show, it's clearly not good for the economy either.
And is there anything in your research to say this has got something to do with COVID, the increase in this problem? Because there has been a significant increase in recent years, hasn't there, in those on long-term sick leave?
Yes, that would be a component part of it. It won't be the only reason. Certainly there's a COVID hangover, and we'll see people suffering from long COVID and extended periods of absence from work. I think there are some other issues as well. The kind of expressed concerns about the NHS and the funding crisis and the challenges there will have had an impact too. And also, I think things like moving to work from home will have an impact, because one of the larger reasons for people being off sick for so long is things like musculoskeletal problems. So we see people probably having setups in their home working environment which aren't ideal either. So it will be a combination of all of those.
Going forward, clearly this is something that we need to focus on. I know the government's been talking about this for some time. Whenever the Labour figures are out, they talk about those who are deemed as economically inactive and the various measures they're trying to put in place, policies to get people back in the workplace. But it says here in your research that only a third of the workers who were off because of sickness were offered employer support. I find that amazing. Only a third.
Yes, I mean, this is a specific kind of support that we're referring to. So I think the workplace is a really important place to look at rehabilitation for individuals looking to get back to work, because there are so many interventions the employer can make. Increasingly, and this is good news, I think we're seeing employers focusing more on the health of their employees, and they're looking at keeping people healthy in the first place. So preventative measures, looking to keep them safe, looking to keep them healthy. But once individuals are off work, it's really important to find ways to get them back into work quickly. We know from the other research that we've done that the quicker someone gets back to work, the less likelihood there is of them being off for any material period of time thereafter.
Peter Hamilton there from Zurich, and that brings to a close.